Left atrial appendage occlusion during cardiac surgery to prevent stroke, LAAOS III trial was a multicenter randomized trial involving participants with atrial fibrillation and a CHA2DS2-VASc score of at least 2 who were scheduled to undergo cardiac surgery for another indication. Patients were randomized to undergo or not undergo occlusion of the left atrial appendage during surgery. Both groups received usual standard care, including oral anticoagulants on follow-up. Primary outcome was the occurrence of ischemic stroke, including transient ischemic attack with positive neuroimaging or systemic embolism. Patients and primary care physicians other than the surgeons were unaware of the trial group assignment. There were 2,379 participants in the occlusion group and 2,391 in the no occlusion group. Mean age of the participants was 71 years and mean CHA2DS2-VASc score was 4.2. Mean follow-up period was 3.8 years and follow-up was completed by 97.9% of the participants. 92.1% of the assigned participants received the assigned procedure. At 3 years, 76.8% of the participants continued to receive oral anticoagulants. Stroke or systemic embolism occurred in 4.8% of the occlusion group and 7% of the no occlusion group. There was no significant difference in perioperative bleeding, heart failure, or death between the two groups. The trial was stopped after the second formal interim analysis of efficacy as per the recommendation of the Data and Safety Monitoring Board and results reported. In this trial, the number needed to treat NNT to prevent one stroke over a period of 5 years was 37. This meant that 37 patients needed to undergo concomitant left atrial appendage occlusion during cardiac surgery for other indications to prevent one stroke over the next 5 years. Another aspect mentioned in the report is that left atrial appendage is a source of natriuretic peptide. Hence, removal of the appendage might impair renal clearance of salt and water and increase the risk of heart failure. Earlier studies had considered this aspect. An observational study included 77 patients who underwent left atrial appendage closure, of which 38 had an epicardial and 39 an endocardial device. That study assessed key hormones involved in systemic homeostasis. These were adrenergic system hormones adrenaline and noradrenaline, renin-angiotensin aldosterone system hormones aldosterone and renin, and natriuretic hormones atrial and B-type natriuretic peptides. The levels of the hormones were measured immediately before the procedure, immediately after the device deployment, at 24 hours, and at 3 months follow-up. Metabolic system was evaluated by measurement of adiponectin, free fatty acids, insulin, beta-hydroxybutyrate, and free glycerols. That study authors concluded that there were substantial differences in hemodynamics and neurohormonal effects of left atrial appendage exclusion with epicardial and endocardial devices. Another study queried a national database and analyzed 253,287 patients who had undergone coronary artery bypass graft surgery. 7% of these had received left atrial appendage closure. Greater risk of postoperative respiratory failure and acute kidney injury were noted in those who had left atrial appendage exclusion. There was no difference in in-hospital mortality, but there was a greater risk of 30-day readmission. A non-significant reduction in stroke was noted. Authors of that study concluded that post-operative measures to mitigate the loss of the hormonal and hemodynamic effects of the left atrial appendage may increase the therapeutic benefit of the procedure. LAAOS III authors did not observe an increase in hospitalization for heart failure in their study, either early after surgery or during long-term follow-up. Currently, concomitant left atrial appendage occlusion has a Class 2B recommendation. It is expected that, based on LAAOS III trial report, it will soon be upgraded to Class 1. In this context, the initial left atrial appendage occlusion study LAAOS was a randomized clinical trial designed to evaluate the feasibility, safety, and efficacy of left atrial appendage occlusion for prevention of ischemic stroke in patients undergoing coronary artery bypass graft surgery. Left atrial appendage occlusion study 2, LAAOS II, had randomized 51 patients to either left atrial appendage occlusion or no occlusion. That study documented the safety of left atrial appendage occlusion at the time of concomitant cardiac surgery. Here are the first set of journal references. Second set of references are here. Thank you for watching this video. Please subscribe, like, share, and post your valuable comment below this video.